观察一下，可以比较更正确的了解我们这里菲律宾的情况。
Can we have the first slide? So we're showing you the global data as of April 5, that's 2020, 6 o'clock in the evening. The total confirmed cases is over 1 million. But we'd like to show you the contribution of the Philippines to the overall global case. So as to the confirmed cases, we're contributing about 0.28%. And for the deaths, that's about 0.24%. And we'd like to compare our standing also looking at countries with the highest cases. Of course, we look at Eastern Mediterranean, but in the Southeast Asia, we have Malaysia.
他说呢，现在呢，全世界超过100万的得到这种的病，菲律宾呢，全世界呢0.28%的%，然后呢，死亡的人呢只有0.24%的%。它跟那个全世界最多的国家呢，像美国呢、意大利呢、中国人和西班牙呢，比较的还是很远。在这里在这个东南亚的呢，就是跟马来西亚比较差不多都一样，3000几个positive cases。
So can we have the next slide? So this time we're just looking at Philippine data. So in the Philippines, as of April 5, 6 o'clock in the evening, we have 3,246 confirmed cases. Currently admitted are 1,633. While we have great number of deaths here in the Philippines, and that's our recovery, our case fatality rate is 4.6.
到4月5号呢6点下午，一共有3200位人得到这个病，其中呢1633位呢住院，152位呢死亡了，恢复的呢只有64位恢复。
So we also monitor Filipinos outside of the country, so overseas Filipinos. As of April 4, that's 448, and the 448 are coming from the Asia Pacific, the Middle East, Africa, Europe, and Americas, and here are the numbers that we have.
这是说我们国外的菲律宾人，全部呢有448个会有得到这个病，其中呢434个还是所在，14个死亡，在那个外国呢，211个是在亚洲呢，太平洋这些地方，148个在欧洲，37位在美国，52呢在中东这些的地方。
So Philippines has a lot of overseas workers that are coming back now. So also we report the repatriate. So Filipinos coming back to the Philippines. As of yet, this is as of April 4, 12 noon, we have 6,244 of the Filipino repatriates. 2,896 are persons under monitoring. 12 patients under investigation. We have 4 currently admitted. 3 of them have become positive. And all the others are still on deck. That's 3,190.
全部呢有6240位的菲律宾外国的人呢，已经传回来菲律宾的，全部呢有2896位呢，是在观察 12个呢是怀疑者，4位呢就是住院呢，这3位是发现就是正确得到这种病，还。
So we're also monitoring foreign nationals. So on the other side, so that's like. So that's 39 confirmed cases in the Philippines. So these are foreign nationals who came here to the Philippines and diagnosed positive here in the Philippines. On the other side, that's 49. These are foreign nationals who traveled here in the Philippines, most probably incubated the disease here, and so when they return to their countries, they turn positive. So we're also monitoring this.
39位呢，的外国人呢，就得到这个测检官的，然后呢49位呢，就是说49位外国人呢，回到他们的祖国，得到确诊观测，那是49位。
Well, this is just the report on the repatriation that we talked about before, so I can go to the next slide. So now we're looking at patients under investigation. So when we say patients under investigation, these are persons that manifest signs and symptoms of a fever, dry cough, sore throat, respiratory symptoms. And this is a report from the local government, Department of the Interior and local government. So based on the reports that's April 4, we have identified 13,025 persons or patients under investigation. 6,330 are in the cities. 6,695 are in the municipalities.
其中有13,25位疑似患者，其中呢6,330位呢是在大城市的地方，6,995呢是在室外的地方。
So this is just the distribution across the different regions and we see that the highest is in central Luzon, very clear.
他说呢，最大的部分呢，就是在这个移送的，就是中心，因为这是跟我们的大省部的Metro Manila呢比较近，所以呢，最多的都是在这里的移送。
This time, let's talk about persons under monitoring. So they have been persons under monitoring are persons that have been exposed, but not necessarily ill. Okay? So based again on the Department of Local Government, that's 325,588. 75,731 are in the cities and 250,000 are in the municipalities.
现在有325,588位呢，是在那个注意观察的，因为他们曾经跟得到这种的病呢有接触，所以他们应该要自己注意观察。75,000呢是在这个省市中心，250,000呢是在省外外。
So just again to show them that the highest number of persons under monitoring are in fact in region 11, that's Davao region.
多的在注意观察的人呢，就是在那个南部的最南部的地方，大报的地区把握。
So this time, let's talk about diagnostic capacities. So this is testing. So the main laboratory for testing is RITM, that's the Research Institute for Tropical Medicine. It can do over 1,000 tests, but we have one in the Cordillera region, that's Baguio General Hospital and Medical Center. Another one here in the National Capital Region, that's San Lazaro Hospital. Well, also here in Metro Manila, St. Luke's Medical Center, but that is yet to become accredited. St. Crisosto, that's Region 7, that's in the Visayas. Southern Philippines Medical Center, that's in Mindanao. Also here in Manila, Lung Center of the Philippines, an academic institution, UPNIH. The Bicol Regional, that's in the regional office, and the Western Visayas Medical Center, that's in Region 6. So we are trying as much as possible to increase our capacity to tests. Our requirement is about 8,000 to 10,000. So with this, we're about half of it. That's 50%.
他说呢，菲律宾现在需要差不多8000个检测器，然后呢，现在只有 RITM 呢一天可以达到1000个检测的能力。另外呢，Lung Center 就是肺部的菲律宾肺部的医院，UP 是菲律宾国立大学的医院，San Lazaro 也是一个注重这样的infectious 的医院呢，都是在属于那些医院还有了。然后呢，在这个中岛呢 Visayas，然后南岛呢 Mindanao 也有几千台可以做这种的志愿者的能力。所以呢，我们菲律宾现在还需要4000个检测的能力的，所以还是很远。
它这个只是一半的，他们展示了一半的检测能力，而且 RITM 就是他们这里的菲律宾的热带雨林研究中心，也是最大的、最权威的一个检测中心，每天只能检测1000个现在，所以他们亟待需要再扩充一下他们的这个检测能力。
So these are our capacities actually for testing. So currently, as of April 5, we still have 106,621 currently available test kits. So what we're saying is that each test kit equals one person. So in the next days, we are able to still test this number.
所以现在还有检测试剂呢，一共还是有621个检测试剂。
And of course, we thank the Chinese government for actually providing us these test kits.
他们跟中国政府呢很大的感激，因为呢都是中国政府呢捐来菲律宾的检测证据。
Next. So still looking at our capacity to do tests, as of April 4, 2020, we have a total number of 20,092 tested in these different sites. Well, that was data of April 4, so those were the positives, 3,414, and the negative tests about 16,000. So that's about 83% of the total tests are negative.
那个确定的检测呢，大多数都是在这个 RITM 的菲律宾的
热带雨林检测
有3133个，然后呢，其他的都是还没有100个，就是在辟谣的中心，辟谣是这个菲律宾的北方的地方，然后 Vicente Soto 是菲律宾的中岛 Visayas，and Western Visayas and the Southern Philippines 是那个南 double 的地方。
他说是83%检测出来的都是阴性，阳性只有3414例，总共检测20092例，所以他们的阴性检测的结果是比较高的。
So next. So we still have other laboratories, hoping that in the next weeks we should be able to accredit more laboratories for mass testing.
现在呢，还有差不多80个实验中心呢，在等他们能够授权，因为他们会看到他们有这个能力来做这样的检测。
Okay, next slide. So today, St. Luke's and the Bicol Regional Medical Center should be fully functional. Next slide. And on these days, April 10, these 3 other hospitals should be functional for mass testing. And these other laboratories. So this is the report from the Research Institute for Tropical Medicine that shows you that actually as of April 5, they have received 25,500 samples. But not all of the samples are tested because some are rejected before they go through the sample. It has to be inactivated because that's the process, and then tested. So as of yet, results that were released is about 20,464.
那个 RITM 呢，到今天呢，一共收过25,000个检测，其中143拒绝，因为大概检测的方法不相同，还是不拒绝了。然后呢，已经发出20,464个检测了，发出他们的结果。
检测结果就是现在已经有结果的是20464例，总共收到的检测试剂是25501例，那么其中拒绝收治143例，因为可能不同的这个检测方法跟这个什么，然后还有285例现在正在储备，还没有做正式的检测，那么剩下的就是已经检测的试剂是25038例。
So we can go to the next slide. So putting it in a graph this time, these are the daily specimen collection. You'd see that the dark blue are the released results over time. Since we start testing in March 1, there has been increase in number of testing. Of course, there are a few, because this is just April 4 and April 3, that has yet to be detected. The turnaround time at this point in time is 2 to 3 days for the results.
这是代表呢，我们在3月1号呢到4月4号的每一天得到的那个检测的数目。你看呢，那个深蓝色的就是说检测已经完毕，发出来了。差不多在3、4天内呢，那些检测的结束呢，可以发出来。
Next slide. So we'd also like to show you the number of specimens by COVID-19 test results. So the gray bars, so all bars each day has gray bars, and these are the negative results. The blue bars are the positive results. The yellow or orange bars are those that yet to be released. But we'd like you to look at the graph shows the number of or the percentage of positive cases as we go from each day. So there has been a peak around that's March 22 and 23, and then we're seeing another increase now this April.
他说呢，在这个呢蓝色的就是那个positive 就是
阳性
检测，那个灰色呢就是说阴性的检测，那些黄色呢就是说还在等他们的，and then the equivocal 那个
Well, yeah. Well, equivocal because the initial screening test was negative, and then we had the confirmatory test became positive. So they have to restudy that.
equivocal 呢，它的意思就是说，第一次的检测呢是阴的，不过第二次检测是正的，所以呢，他们就要看一看呢，到底是怎么回事。
他们这边就是最开始的时候，他们用这个试剂盒检测，但是发现试剂盒检测没有 PCR 的准确，但是 PCR 的检测数量比较少一点，比较慢。然后就是这个红线呢，就是它这个每天的这个确诊率，然后正在上升，从3月23号以后，23、25号，一直到4月份到今天，仍然是有上涨的趋势。
Sir, the confirmatory test, is it correct for me for us to say that the first test would be the rapid screening, and the second test is
No, actually it's the PCR test.
So PCR initially PCR confirmed.
PCR, yes.
都是用 PCR 在做检测，然后第一次结果是阴性，第二次结果是阳性。
So this time, let's talk about patients. So these are the number of patients tested, 68% negative results, 15%. These are the positive results. Oh, no, this is 17%. 17% positive results. The blue ones are still for testing, and very few equivocal.
大部分呢68%呢就是阴性的检测，17%到3494位呢是阳性的检测，到现在呢还在等15%，就是3000几位呢在等他们的结果，然后呢很少，只有差不多还没有1%呢，就是他们还不一定，就是说第一次阴性，第二次变成阳性。
Next slide. So, of course, we're still talking of COVID by date of list of specimen. So this is, well, I think this is a repeat slide. So we can just go to the next slide. So now looking at where the slides or where the specimens or where the cases are coming from, most of them are from the National Capital Region, and then we have in Luzon 4A and Region 3. So I can just show them here in the map. Yeah. So most of the cases increased cases in this area.
增长率最高的在这个地方。
National Capital Region, and then here, and then here. So actually, it's the whole area. Yeah.
马尼拉大部分首都地区。
我们的首都就是马尼拉的，他是说这首都这个地区呢是最多的，然后呢，在这个吕宋的岛呢，中间吕宋岛是比较中心，所以大部分的都是在这个中心。
Next.
这里最快就是这里。
Also, just a report of the age and sex distribution. So in terms of sex, we have more males than
年龄，你可以看呢，最多的就是60岁以上的老人家，男性呢比女性呢得到这种的病，我看大概在全部的年龄呢，只有那个21到30个呢，那个女性比较多，全部呢都是男性比较多的。
Well, one of the things that we do is to strictly implement enhanced community quarantine, social distancing, and segregation. And so we have quarantine control points. The quarantine control points are worked out with the Philippine National Police, and we have quarantine control points that's been worked out with joint task forces. So joint task forces, these are the Philippine National Police, all uniformed men, and the Department of Interior and Local Government, and then of course the Bureau of Quarantine of the Department of Health. So it's being done in land-based airports and seaports.
这张图表主要说的是他们现在菲律宾采取的一些隔离政策。首先是封城，然后就是 social distance 社会的个人距离保持，还有就是个人的居家的一个个人卫生的防护。然后他们采用了所有的工作人员，包括军队，包括警察，也包括所有穿戴制服的工作人员。那么到现在为止，他们所有的这个工作区域就是大部分在各大城市、机场和港口。
When you say task force, that means
Well, in the Philippines, the National Task Force is the main task force that covers COVID-19.
那么这是在菲律宾有一个专门的这个力量。
It's an interagency task force.
就是专门针对这个新冠肺炎的一个小组。
Next. So we also look at maintenance of peace and order, and we have the status report on violations. So some not so very well are arrested. These are the numbers, around 700. So there are people have been fined, and of course a lot of people have been warned about it.
这就是一些违反隔离令的、被抓的、被释放的、被警告的，还有就是有些被起诉的。
有的是罚钱的，有的是警告，是这样。
Next slide. So what are we doing now? Here in Metro Manila, we have came up with response quadrants. So that's 1, 2, 3, 4 quadrants. So north, east, west, and south. And that's how we're dividing work across Metro Manila. And these are, of course, the cities in Metro Manila.
他就把这个移送中区呢，他分成4个部分，一个东，一个西，一个南，一个北，就是说那些每一个部分呢，就是负责那些程度的病情是这样。
它分成4大区域，每个区域都有几个城市，然后这几个城市集中处理。
Next. So just to show you, because we have mapped out hospitals at different levels. So 153 hospitals are actually in the National Capital Region. But we look at the inventory that includes both public and private, from level 1, which is primary, to level 3, which is tertiary hospitals.
在首都地区，我们有153家医院是现在是工作的。那么剩下的就是从1甲到3甲的话，他们现在对，这153家里面包括1甲到3甲医院。
hospitals across the country. Most of them, of course, are NCR, but we look at COVID hospitals for each of the regions.
他们有55家现在能够收治新冠肺炎的医院55家，然后每一个区域在菲律宾的每一个区域、每个岛上每个区域，它都有对应的一家医院可以收治新冠肺炎病人。
The next slide. Also look at other level 2 and level 3 hospitals in each of the regions, both public and private. We have 450 facilities that could cater to also severe cases of COVID.
2级和3级医院，他们有450家，包括无论是公立的还是私立的，总共在一起有450家，在每一个区域都有对应的医院可以收治新冠肺炎病人。
Well, just looking at a national capital region as of yet, we're looking at May 4 as the timeline to put up 813 beds. Now, we have about 507 to 620 beds. By end of May, we should have at least 830 beds ready for critical cases.
他们的目标呢，是在5月4号呢，要出830个病床，专门治这种的病，其中呢，最多就是在 UPBGA， 就是菲律宾国立大学的医院，然后呢，就是4间政府支持的医院，
定点医院，定点医院。
Next. So data as of April 2 to cover severe and critical cases. So beds that are available for COVID is about 2,976. There are 507 beds in the referral hospitals. Expected severe and critical cases in the next 2 weeks is about 1,000 to 2,100 cases. So we're covering that, granting that we have this number of beds.
现在呢有3300间的这个COVID 的床铺病床，其中呢2级和3级的是2796床，然后呢这个政府规定的 COVID 的病院呢有7张床，所以呢我们是在2个礼拜后呢，我们是在看大概有1049至2099的新的这个 COVID cases。
The use of mechanical ventilators as of April 2. Mechanical ventilators available are 1,263. So in the next cases, if you have new cases needing invasive ventilation in the next 2 weeks, our prediction is about 28 to 56. As of yet, we are using 68 ventilators.
在那个2级和3级的医院呢，一共有1263张的人工呼吸机，现在呢用的只有68个，他们在2个星期内呢，他们要再等待差不多28至56个需要这个人工呼吸机的病人。
And of course, we have level 1 facilities. So these are facilities that will be used for very mild cases in any case that we have need them. So we have identified also 795 level 1 facilities, both in the public and private sector in all the regions.
全部呢有795张呢，在这个1级的设备，这是比较那个轻微症状的病人呢，所以那是说不是太严重的情况。
So at the local government, this is a report from the internal and local government. we also established quarantine areas for patients under investigation and persons under monitoring. So these are not the usual hospital sites. These are, how do you call it, cabin facilities or quarantine facilities in the local governments. So we have identified the number of isolation units, which is about 10,575. We've also identified the people that will be working with us, which is about 15,000 and 7,000 coming from the military to help us. And then the number of transportation, because we will need transportation, that's about 263. And then versus barangay health emergency response teams. So these are the response teams in a village. That's 28,799.
这是他们菲律宾政府关于这个隔离地点的对这个疑似病例和自我隔离的一个设立的地点。那么现在他们有这个工作的区域有10575个地方，然后他们有警察，还有一个特殊的这个职务部门 DFP。然后他们的交通现在他们征集了交通有263个，可以帮助输送这个病患和工作人员。然后对于这个镇政府，他们的barangay在我们那边是镇政府，镇政府的工作人员现在有28799位，帮助处理这些疑似病例和隔离病人。
So this time, let's go to contact tracing. What is our capacity for contact tracing? And we've identified people from our surveillance units, regional epidemiology surveillance unit staff. That's about 259. Not a lot, but we have identified primary care personnel that will help us in contact tracing throughout the country. That's about 16,221. So that's about 16,500 people doing contact tracing.
这个就是他们在追踪这个和相关的谁接触过这些疑似病例的人，这些人都是工作在这个方面的人，一共在这个他们的急救中心的话有259位工作人员在做这个事情，然后剩下的就是还有一些当地的一些个人的话会有志愿者的话会有16000多人在工作这个追踪这个已经感染的和那个疑似病例。
Next slide. So we also look at human resource or health workers in active service, both in the private sector, in the public sector. These are health facilities. But we also look at human resources at the rural health units and municipal health units. So private, public, municipal, or rural health units, and we have a total of 172,744.
这是他们的医务人员的能力。现在就是在私立医院的话，我们有58913位医护人员，在公立医院有61492位，然后还有剩下的一些专职的，像这个受过培训的急救的这些专业人员有52139位，总共现在从事这个医护工作的有172,744名医护人员。
So these are our main issues and concerns as of April 5, because we also report our issues every day. So one of the issues reporting on health statistics, this is actually related to contact tracing of personnel who are quarantined and persons under investigation. So we really want to see to it that we have a central repository of information, and as low as the barangay health unit, municipal, province, region should be reporting at the epidemiology bureau. And then I can go to the next.
这里是他们主要的一些考虑的问题和这个东西，直到4月5号下午4点，因为他们每天都会进行汇总这些问题。那么现在的话，就是对于他们这个 health statistics，就是他们的怎么 说呢？卫生情况的话，他们现在主要是还在做这个追踪，这个和疑似病例接触过的这些病人，包括还有很多在家里居家隔离的，还有疑似病例。
So the other one are PPEs, protective personal equipments for quarantine facilities, local government units to accommodate 3,660 PUIs. We'll be needing this much of PPEs in the next 14 days.
他们说现在就是对于这个个人隔离服的需求，在未来的2周内可能还需要180万套，现在需求量缺口非常大。
As far as human resources for health in quarantine facilities, temporary quarantine facilities, we need 440 doctors and 1,756 nurses. Although we have a lot, when you say that we will have to serve for COVID for quarantine, it's really difficult to get volunteers.
他们仍然需要440位医生和1756位护士。虽然他现在在大量的召集这些医生跟护士，但是还是很难招到志愿者，非常难招志愿者。
And then sampling, mass testing of persons under investigation. We will need an additional 773 medical technologists if we want to finish 3,660 specimen collection.
他们需要更多的检测人员，在完成还有3660份检测样本没有完成，他们仍然需要更多的专业检测人员。
So, and the last one is, of course, on contact tracing teams. We really need the names, addresses of persons or patients under investigation, and this will be provided by the local government's DILG. So we want to disaggregate data up to the barangay level to make it easy for us to locate them and to isolate them.
他们现在还有一个考虑的问题，就是关于在追踪这个接触过的有接触病史的病人的时候，他们想让这个地方政府，包括镇政府以及到了很小的这个最基础的底层单位，能够一层一层向上报以后汇总，但是现在这个事情还没有完全的完成。
So I think this is the last slide. Well, it just shows us the data that we have now. We did not process this data because we want everyone to process this data as we go from the institutions that we will be visiting towards the next week. I hope that as we go through the visits, we should be able to see the actual situation. We should be able to see the needs and requirements, and then provide us the technical assistance that we need. So there are, and then I can continue.
他是说呢，这些他刚才报告的呢是一个大概的在你们下两个星期呢，你们天天都会看到这里的进展。假如有什么新的发现呢，你们我们也要跟你们学习怎么样比较更好的来管理这些问题的这些病人的方法。
So very important to us are infection prevention and control. And we'd like to see areas of assistance in surveillance and contact tracing. Assistance as we improve our diagnostic capacities in terms of mass testing, in terms of human resource capacities, in terms of putting up isolation beds, both in the hospital and at the local level. So I was told earlier that there are experts here that are very good in putting up quarantine facilities. And then, of course, medical management. So medical management in terms of the way we should be treating people. And I think we have experts here for both Western and Eastern medicine. And we will get that experience. And of course, social distancing practices. So personal hygiene, cough etiquette, isolation, containment, and all those.
他的意思是我们希望在今后的工作当中，我们要对我们的监测，包括我们的汇总性数据的收集，希望能够再加强一点。然后另外一个呢，就是对于这个这个传染疾病的控制、预防、发现，能够抓得更早一点，能够做得更好一点。然后他听说咱们这边其实有医生是非常有经验的，对于建方舱医院，所以对医院的一些管理，所以他希望在今后的接下来的工作中，能够向你们学习到这方面的经验。另外一个就是他希望继续提高实验室的检测水平，能够对大众进行更多的检测，以便更早的发现这个疑似病例，更好的发现这个确诊病例。那最后一个就是他们希望就是我们这里有中西医结合的医生，能够在对于这个病人的治疗上，能够给出更好的诊断方案、治疗方案。还有就是在医院的管理上，能够向各位学习如何正确的、有效的对医院的医护人员也好医院的流程做更好的这个管理与这个培训。谢谢。
So I hope we are clarified. We will not ask questions because it will be processed in the days to come. I don't know if they've seen the provisional agenda for the next 2 weeks already.
他说你们有没有看到呢？你们这2星期后的这个计划呢？你们有没有？有了，
Yeah. Okay. So that should be okay then. So we'll see them again tomorrow.
他说明天见，谢谢你。
Okay. Thank you very much. So balik na po kayo sa hotel ngayon.
Ano?
Balik na
Yeah,
kayo sa
mabalik
hotel.
pa sila sa hotel.
Okay, salamat po.
I will meet with them because I have to meet the director of
Chinese, I represent Chinese channel.
So I'll be saying the same.
Yeah.
I'll be saying the same things.
Yeah, we have some questions.
Oh, okay,
Yeah.
okay.
So,
This
sir?
will be for China, right?
Yeah.
Yeah.
May we have your name and title?
Yeah, I'm Dr. Kenneth Ronquillo, Assistant Secretary of the Philippine Department of Health.
We moved to another place.
Okay. We'll change it, please.
Okay. Here. So do I have to state my name again?
It's okay.
It's okay.
Then yeah.
Yeah.
experience are you expecting from the Chinese experts?
Well, from the Chinese experts, we'd like to see a lot of things. As I mentioned, we'd like to see how China did contact tracing and surveillance. That's very important. That goes with it, our epidemiology bureau and our research institute for tropical medicine, seeing that information is taken and managed all together. We'd like to also see how diagnostic capacities are improved. So testing, using other ways of testing, not just the PCR, because I believe there are other ways of testing that can be introduced here based on your experience. We'd also like to see medical management. So in terms of Western and Eastern medicine, I know that there are Eastern doctors, Eastern practitioners, medical practitioners that's here with us. So we'd like to see this balance. And of course, practices, good practices and best practices as we do isolation and containment of patients, proper way of doing things like personal hygiene, experiences on, well, just putting up the PPE maybe. So a lot of things really.
Yes, and in your introduction just now, you mentioned about the management of the temporary hospitals that is under construction in the Philippines. So are you expecting to have more experience from the experts on this side?
Well, of course, we would expect that. We were told that the team here have had this experience in one, and we'd like to see this experience be brought here in the Philippines, so we should be able to learn and eventually curtail, fight COVID here in the Philippines.
And it is reported that the Chinese medicines are effective in China. So are you going to use the Chinese medicines to treat the Philippine patients?
So that's what we want to learn here. That's what we want to see, how you did it in China. We want to see if it's also practical and adjustable and usable here in the Philippines.
Okay, so sir, can you just give us a briefing? Like you just mentioned, like in 2 weeks they have a schedule. Like
Well, yes. In the next 2 weeks, we hope that we should be able to visit hospitals. So hospitals have been designated as COVID hospitals here in the Philippines. We'd like them to see our capacities for laboratory testing. We'd like to see how they do social distancing measures. Of course, we've had a lot of social distancing here, from suspending classes, from putting isolation in some of the areas. But we'd also like to see how they did it in China. We hope to see these experiences. Medical management in terms of treating patients. We've seen how China managed to really lower down COVID cases, and we're interested to know all of this and see if it's adjustable and practical to adapt it here in the Philippines and actually do it.
okay, so and also the doctors will visit our temporary quarantine facility. Like
Oh yes, we'll be visiting temporary quarantine facilities. There are big quarantine facilities being done now, but we'd also like to see quarantine facilities in the villages. So that's what we want them to see as well.
Okay, so do you have any chance to like make a video meetings with some other region like Visayas or
Yes,
Mindanao?
well, we have some scheduled video conferencing with people outside of the Metro Manila. We'd also like to meet them, our experts here in the Philippines. We'd like them to meet our other interagency task forces that are involved in COVID here in the Philippines. And of course, we'd like to see them meeting our therapeutic committees because of the things that China has been doing. So they'll be meeting a lot of different types of professionals, not only medical professionals, that will actually solidify our plans here in the Philippines to really stop or kill COVID-19. Thank you very much. Yep.
接受采访的。
对。
Now we are going to have an interview with Chinese doctors.
翁院长，也看问题。我们都是中国媒体的，新华社、央视、国际台的。翁院长，想问你一下，您刚刚也听了菲律宾卫生部官员对这个菲律宾现在疫情的一个简单的介绍。您听完之后，不知道咱们这个医疗专家组对菲律宾目前的防疫形势有什么看法，或者有什么，比如说咱们能够给他们提供的建议吗？
这当然呢，今天呢，他们卫生部呢把菲律宾的现在的疫情情况应该做了一个很详细的一个汇报，包括他们目前的现状，他们医院的救治能力、检测能力等等，都做了一个介绍。那从中我们看起来呢，他们现在的检测能力有限。我们正常在国内的做核酸检测，应该当天就能出报告。那么菲律宾呢，现在呢需要48到72小时才能出检测报告，因此呢，检测的能力不足。从他的报告可以看出来，可能检测的硬件上，因为这回疫情呢爆发的比较快，可能硬件准备上一下子来不及。此外呢，他也报告里面也提出，检测人员缺乏这种报告里面说要缺的73位的实验室检测人员。那么看来的检测能力缺乏，第二个的病患收治能力也比较缺乏。他们最近的计划，到了5月份呢，能够再增加2000多张的床位。那么医务人员也缺乏，医生有经验的医生跟护理人员缺乏，因此呢，可能他们将来的应该在检测和医护培训方面还要进行努力。
翁院长，接下来咱们医疗专家组有没有什么特别想去的、特别想看的地方、特别想和菲方交流的问题？
当然，这回呢，我们的医疗队派出来是一支很精干的队伍，尽管医疗组才10个人，其中呢有6位参加过武汉以及这种重症病患的监护。10个队员里面呢，涵盖了临床医生、护士以及实验室检测人员，还有 CDC 的传染病防控专家。因此呢，虽然人少，但是应该比较精干。那么我们呢，打算把今天他们报告防疫的内容呢，我们回去进行讨论，明天呢跟他们继续再交流。当然了，我们背后还背靠了强大的祖国。我们的国内的，我们如果这边医疗队解决不了的问题，我们可以连线回国内，让国内的我们这些智囊团、专家团帮我们出谋划策。因为我们这回的中国的在抗疫中也积累了大量的经验，从疾病防控、检测到临床诊治，都有形成了一套行之有效的方案。
我想了解一下，我们华人啊对这个中医治疗抱有希望，因为国内的第7版公布以后，就是中医的治愈率还是比较好的。那么这次有带了中医的医生来，这个怎么样来施展？另外，大家也关心有没有随机带一些中药来？
这样子，我们这回来的主要任务是交流和指导，介绍我们中国的这种抗疫的经验。但是呢，原则上，因为我们要参考菲律宾的法律，原则上不能做临床的诊治。那么 这回的中医在我们的国内的抗疫过程中呢，应该大家也看到，是我们的抗疫的一个亮点啊。不管从预防到轻症的治疗，到重症的治疗，都配以中西药、中西医结合的治疗，应该来说收到很好的效果。那么当地的华侨的，因为对我们中医的也比较信赖，因此我们这回带了3位我们福建福建中医药大学附属人民医院的3位中医的专家，其中呢1位是中西医结合的呼吸科专家，1位呢是中医科专家，此外呢还有1位护士，参加过武汉抗疫的重症病患的中医科护士。因此这个团队呢，当然呢我们中医的目的呢，一个对华侨进行一些指导，此外呢我们更重要的要预防为主，中医呢有一整套的包括个人防护、增强体质的这些中医的方法，希望我们能够预防为主。此外呢，提供一些中医药的这种指导建议供参考。
还有呢，就是黄大使是希望说咱们10几天的过程当中，能够帮助华人医院以及这里集结起来的20多位医学科的志愿者，能够训练一些简单的一些治疗方法。这个我们有没有纳入计划？
有，我们有纳入计划，这有纳入，因为我们主要是传授，因为医疗队10个的有限，如果从治疗角，当然呢，因为根据当地的法律规定呢，我们不能参加于临床救治，即使参加于临床救治的人也有限。我们希望帮助他们医生、护士乃至检疫人员以及传染病疾控行业的，帮他们进行培训，这样子的可以服务更多的人。
谢谢您，谢谢
好，
您。
谢谢。
因为那个。
We almost finished today's slide. Thank you for watching. See you next time.